Taking us on further to our next speaker, I'd like to bring to you and introduce Colleen Sullivan. Colleen Sullivan is the Director of Public Affairs and Donor and Family Services at CORE, and she oversees public relations, education, marketing to raise awareness and increase organ donation rates. With deep commitment to supporting donor families, she ensures that they have resources and care throughout the donation process. A Baldrige executive, she brings expertise in organizational excellence and innovation into her work in the organ donation field. Colleen, you're on the stage. Thank you.
Thank you so much, Bobby. Thank you for having me today. Thank you to Toastmasters. I'm so pleased to be with you. I'm here to share to you the side from an organ procurement organization. So I'm specifically from CORE, the Center for Organ Recovery and Education, and we're going to talk through a little bit of our life-saving mission. With all of our presentations, we start out with our mission, our vision, and our values. Our mission is to save and heal lives through donation. Our vision is that every potential donor will make a pledge for life. And our values, we have compassion, education, innovation, integrity, life, quality, respect, and responsiveness that guide every decision that we make at the organization. Now, core competencies, what sets us a bit different and apart from some of our counterparts and other organ procurement organizations, we have a culture of transparency to drive performance excellence. We have a continued journey that we will be on until we meet the need of all of the waiting list candidates that are on the list. We pursue every donor every time with compassion and respect. That means even some of our older donors, which you'll see in a couple of slides. Pursuit of every organ every time. We look at one kidney as a way to save one life. So we pursue every organ every time. Now, who is CORE? We are an organ procurement organization. We are federally regulated. There are more than 50 across the United States. As you just heard a little bit ago, some of them have merged and consolidated. So you will see some change happening with that over the next couple of years. We are a not-for-profit organization, and CORE was founded in 1977. At CORE, we have over 225 team members. And our service area covers more than 5 million people. You can see our territory here. We service Western Pennsylvania. We do have one teeny tiny county, Chemung County in New York, and then we cover almost all of West Virginia. Now, within that service area, we have 7 transplant centers. A good majority of those are in Pittsburgh. We have Allegheny General, UPMC Presbyterian, UPMC Children's, and then the VA. Up in Erie, we have UPMC Hammett. In Morgantown, West Virginia, we have WVU Ruby. And then in Charleston, West Virginia, more southern, we have CAMC, Charleston Area Medical Center. And then throughout our service area, we partner with more than 150 donor hospitals and health systems. So this is an established territory by CMS. We are not competing for potential donors within this service area. This is a partnership that we have specifically with CMS and the donor hospitals in our service area. Now, it sounds like many of you are very familiar with all of these stats. We've heard them earlier from Sherry. We've talked about a little bit of what Ann and UNOS are doing, but you know the numbers. We have over 100,000 people waiting for a life-saving transplant. Every 10 minutes, another name is added. And then in core service area, we have more than 2,600 individuals that are listed on our different transplant centers. But what I do want to go to next is focusing on transplants and the number of transplants that are performed annually. We have been tasked across the country to increase the number of transplants. We at CORE live by that thought process, and you've seen it in our core competency, that pursuit of performance excellence. We are going to strive to achieve more transplants year over year. And that's through the generosity of organ donors and folks that are saying yes to donation at that time. So here I have a chart from ranging back to 2015, and you could see the growth that we've had year over year in the number of deceased donors, as well as the number of living donors that provide that gift of life annually. you're seeing more than probably close to 3/4% that are, or 3/4 that are coming from deceased donors. So still lots of work to do on both ends, still opportunities for us to increase the number of deceased donors, as well as increase the number of living donors. But let's talk a little bit more about deceased donation. So organ procurement organizations, we are reviewing the deaths that are coming in and that are happening 24/7. We operate as though we are a mini hospital. There are some of us across the country that have ORs and ICUs at our facilities where we can perform the recoveries at our current operations. We evaluate and procure donor organs for transplantation. We coordinate that process. And most importantly, we're supporting our donor families during and after donation. We educate the community and increase the number of donations. And most importantly, back to our mission, saving and healing lives every day. Now, with organ donation for deceased donors, you have the opportunity to donate heart, lung, liver, kidney, pancreas, small bowel, and intestine. I think Sherry alluded to this earlier. We have a small opportunity and a very small window of folks that actually meet criteria to become a donor. To become a donor, you have to pass away in a hospital setting for organ donation. Your organs have to be ventilated. They have to be receiving the oxygen to be viable for donation. And an individual needs to be pronounced brain dead or passive cardiac death. And there are no age limits to organ donation. Again, we will pursue every organ every time, every donor every time. And a few years ago, right here in our service area, we had Cecil Lockhart, that was the oldest organ donor in history at the time, 95-year-old man from Short Pole, West Virginia, that was able to donate his liver to folks, a woman down in Florida, and she was in her 60s. The liver was so incredible that the surgeons came in and they actually covered up his age and made some of the doctors in Florida guess how old the liver was, because just because he was 95, they still had a perfectly good functioning organ available for transplant. Now, what does the deceased donation process look like? It starts with all of us here. It starts with education out in the community, providing those opportunities to inform folks of what donation really looks like and put faces to that. Designation, we want folks to sign up and put it on their driver's license. Signing up on your driver's license is first person authorization, and that's legally binding. When it's on the driver's license, that is indicative to say that this individual has made that decision that they would like to be a donor. And we use that as almost as though it's a living will. We use that as a legally binding document, and we are working to uphold the wishes of designated donors. So these are the two areas that we in this group here today have great opportunities to make change in. So what happens post designation and actually kind of kicking off more of that deceased donation process? It starts with the referral. The referral comes in from the hospital. As I mentioned, we partner with more than 150 donor hospitals. They're calling in, making the referral to us. We screen for suitability. We then approach the family, and hopefully the authorization has already been given through the designation on the driver's license. If it is not, we approach the next of kin and the appropriate family member to make that decision. We manage our donors, we allocate, identify who is the best fit for the organ, and went over that earlier. You understand a bit of the matching process. We recover, and then we move to transplant. Now, again, this group, what do we have opportunities with? Authorization and increasing the number of designated donors. You can see here, these are the numbers just from Pennsylvania for the numbers that we have folks signing up at the DMV and folks that are signing up through Register Me and online. So our rates have been fairly stagnant over the last few years. And unfortunately, we know there's a lot that's happening in society right now with post-COVID, what life looks like, trust of the healthcare system. So you can see we're actually taking a bit of a dip in the percentage of folks that are registered in Pennsylvania in 24. We haven't gotten our first quarter numbers out for Pennsylvania in 2025 yet, but we do anticipate that that might be a bit of a dip too. But how do we increase those numbers, and what can you do? Helping to save lives through storytelling. That is one area that each one of you have to really put that face and the connection to donation. Because right now, when we have our opportunities to go out in the public, we know that facts are just not enough. Think about some of the times that you maybe have tried to ask someone to do something just using facts and tried to convince someone of something, saying, one person can save 8 lives and 75 more through tissue donation. Now, how often does that work? Probably not very often. The truth is, facts alone don't change minds. They should, but they don't. Only 40% of folks actually trust doctors and hospitals today, and that's down from 72% just a few years ago. I think we just heard from the last panel, we have folks that are going online, getting their research and their information from folks, and they don't know if they're validated sources. So people don't always trust the numbers, but they do trust you. They trust real people with real experiences, and that's why storytelling is one of our most powerful tools. Now, let's be honest, most people don't make decisions based on cold, hard facts, but if they did, we'd hopefully have 100% organ donor registration rate, no questions asked. But the truth is, little over half of the people think that science has a positive effect on society. And post-pandemic, trust in doctors and hospitals, as I mentioned, has dropped from 72% to 40%. So people don't always trust the facts, but they're trusting you. So stories create change. This is where it gets cool. Studies show that stories are 22 times more memorable than facts alone. Think about that, 22 times. Now, why do real stories resonate more? They create emotional engagement. Stories trigger emotions, allowing people to feel in a situation rather than just understand it intellectually. Facts go to the brain, stories go to the heart. All of you have personal connections. We can picture ourselves in that situation and can allow someone else to think that way as well. That personal connection makes it hit deeper. We're providing concrete details. Real life experiences provide details and context, making information more tangible and real. So inspiring information and inspiring action. So what this means for you, you're making donation real for someone who may have never thought about it before. You're helping people see themselves in the decision to say yes, and you're creating a moment that sticks in their mind long after the conversation is over. Now, the perfect pair, stories and facts. Now, before we get all swept away in storytelling, facts still matter. We want you to make informed decisions. We want people to make informed decisions, but facts on their own don't move people. Emotion does. So stories bring emotion. They draw people in and make what you're saying more memorable. Facts add the credibility. So that backs up your story with the truth. And when you're putting that together, we're creating something powerful that sticks with people. Now, places where you can share on social media, whether that be your personal page or course page, community events, conversations with family, or even news stories. Just one conversation with one person can save lives. You can collaborate with your organ procurement organization. At CORE in Pennsylvania, we have established End My Wait campaigns. We have individuals from our service area that are in need of a life-saving transplant. We've taken photos of them, created brochures, literature, material, and drive that call to action where folks can register. You might not have someone that wants to register or sign up to be a potential living donor, but what we could do is we could inspire both. We can inspire, if you want to register to become a living donor, sign up as a deceased donor as well. Or the other way around, if you want to register, think about registering as a deceased donor, you can consider living donation. So these brochures and literature do just that. It allows us to talk a little bit about both and feature the waiting list candidates that are waiting for that life-saving transplant. Here's an example of a little boy named Lucas from the greater Pittsburgh area. His story helped to drive over 700 registrations on the Register Me page just because of his one individual story. We've generated additional campaign materials for others in our area, and I'm sure that your local OPO would be willing to do the same for you. So if you have not, hopefully everyone here is a registered donor. If you have not, please make that decision to register today to encourage others to register. Collaborate with your OPO. Join as a volunteer. You get that peer-to-peer support. You hear from other recipients, donor families, waiting list candidates. We help you craft your speech. We're trying to work smarter, not harder, and get more folks out there to sing from the chorus and ensure that folks can understand the importance of signing up. Hopefully you all again know the national observances. We have Donor Day, February 14th. April coming up right around the corner is National Donate Life Month. All OPOs are looking for stories right now to share. Hospitals are looking for stories to share as we partner and we collaborate together on some of these flag raising ceremonies. In Pennsylvania, we have August 1st as PA Donor Day. August is also National Minority Donor Awareness Month. And in November, we celebrate National Donor Sabbath at some of the religious affiliations. And I'm so proud to say that at CORE, we celebrated our 6th record-breaking year for donation. We increased by 17% in our organ donors. My cue to wrap it up here. We had 472 organ donors that selflessly gave that gift of life and families that did just that. And then we saved 970 lives through organ donation. So again, so proud of the work that we've done and look forward to extending our reach as we move into 2025 and looking forward to signing up more donors. Thank you for your time.
Thank you so much, Colleen. I really appreciated that. Perhaps into the chat, you could put in there how people can recruit people to go and register, like a link or an email. And that could be used nationwide, or how they find who their local OPO is, because we have people on here from all over the country, and that would be helpful for everybody to see. I want to elaborate, just take a minute here too, and build upon what you said regarding storytelling. You know, at Kidney Stories Toastmasters, our mission is to continue supporting the transplant community. And whether you're a professional or a patient or a caregiver, we believe in learning from one another and growing together. So, enrollment right now with Kidney Stories Toastmasters is open until April 1st, and we warmly invite you to join us. Toastmasters will help you become a better speaker, and